welcome to you all. We want to bring together all stakeholders to really align priorities, urgencies, and speak with harmonized voices to achieve policy results.
That a big positive transformation in diabetes care is around the corner. We need to validate the experience of telemedicine and other digital solutions during the COVID to lock in the advances which we made.
That collaboration and partnership are the fundamental step for really building a better future for people with diabetes. We can delay complication as I introduced if we can invest for widen the access to technology and innovation in Europe.
The digital health application shows positive care effects. That digital technologies, in many cases, can have an impact on other aspects of patients' life. That there's an incentive for both payers and digital health manufacturers to set up pay-for-performance models.
We switched from 10,000 teleconsultation per week before the crisis to a peak of 1 million teleconsultation per week. We see that telemedicine is now clearly integrated in the care, but it's a time to transform the experimentation into ordinary case solution, and this need to reconsider the financial support.
In this tool, we've had another set of sub-tools like video conference, a platform for sharing documents, sharing reports from CGMS or sharing the lab results. We've had a permanent call center.
We start off with this discussion session with Bastian Hauck.
Let me tell you, I just had my first visit with my diabetes nurse and my doctor, my endocrinologist, 2 weeks ago. I uploaded my data from my CGM to the cloud. They looked at it before meeting me, and we had a Zoom call just like this one. That's telehealth for me. What we call routine visits, that will change. It'll change dramatically. But if you listen to what people with diabetes out there are saying is, we want digital, but we also want personal.
We can see that there is a shift towards virtual consultations to introduce new digital services to their arsenal of how they manage and help people live with diabetes, and others saw it as opportunistic and beneficial to be able to remotely access data and conduct video consultations.
And I consider that as an opportunity. I consider that any crisis as an opportunity to improve. And I think that this is an opportunity to change how we are delivering care. And this means an opportunity to transform. And that it means, in my opinion, to try to look for what is the good contact, the ideal contact we have to provide in each situation.
Research progress towards digitalization of the healthcare sector, improving health infrastructure by turning digital, will facilitate better healthcare and access to healthcare for our citizens foremost. A growing number of digital programs and in-health tools are proven to improve health and lower the cost of care. This crisis shown the need of digital tools and services in order to have the continuity of care.
Digital needs to be done well, and the question is, how do we do digital well? And the easy answer to this is, don't design solutions for us, design with us.
Digitalization in health has the highest ranking. So national governments which are asking money from the resilience instrument to digitalize their healthcare systems, and of course the solutions for diabetes could be part of this, have the highest chances in order to get this money.
I heard very clearly that there is indeed a readiness for digitalization. There needs to be willingness of partners, and there I mean the medical professions, the nurses, the dietitians, everybody who needs to be engaged in healthcare, but not in the least of the person living with diabetes, and of course also from the payers. And I would really ask you to join us on our social media, on Twitter, on LinkedIn, and if you want to know more about us, go to the website or just send us an email here at info@eudf.org.